Today we have Dr. Dilip Raja with us. He is an urologist and an enterologist. Well, he is practicing in Mumbai, Maharashtra. We're going to be talking about kidney stone management with him. Very welcome, sir.
Hi, thank you.
Well, very first question which comes to my mind is why are the cases of kidney stones are on the constant rise these days?
I think it's very simple. It's a lifestyle management.
Is it?
Lifestyle management in the sense, I would say, a lot of classes which are coming, living more sedentary life rather than the active life. They have tight schedules, they have busy office hours, they don't drink enough water, they consume all junk food.
Yes.
So it is like a saturation, supersaturation theory. If you take half a glass of water, for example, and if you keep on adding salt or sugar into it, what will happen? Up to a certain stage, it gets diluted. After that, what happens? It settles down. So similarly, whatever junk food that you eat, like like all kinds of junk food, starting which all contains milk products, then this kaju, badam, pista, and all that. Just sitting doing nothing, and you're constantly bunching and something. Drink less water. You're living more in air-conditioned atmosphere. What happens? You have less water. You have more ingestion of this. So they go and settle down. So this, I think, lifestyle management is one of the parts because of these two reasons.
Yes.
Can lead to increased number of stones formation.
Well, sir, what makes it is a very important thing to be diagnosed at an early stage and not delay the process when it comes to the kidney stone.
Of course, you have to diagnose it early. Sometimes what happens, even diagnosing early, say for example, you are living in a dry, hot climate, Gujarat, Rajasthan, you will find every household has a stone.
Yeah.
Why? For the same reasons. Now, if you have pain, you will come to the doctor, urologist at the early stage. But there are many of these places which are called stone belt zones, where the stones are practically forming. Initial stages, everybody takes that small little pain here and there as a small thing, ignore it. When generally patients come to us when they have an increased pain or blood in the urine or severe urinary symptoms. If you don't have these symptoms, there are sometimes the stones remain silent into the kidney, and they may eat up your kidney. So I think in a kidney stone disease, getting a pain, blood in the urine, fever, infection in early stages is a good sign because your attention is drawn towards it. And that's when you come to the treatment early. And if you diagnose them early, obviously you treat them better.
And what are the complications if it is diagnosed late?
As I said,
what severe things?
Anything can happen. The kidney can get infected. You can get severe pyelonephritis. The kidneys can get contracted, and in the extreme stages, the kidneys may even fail.
Well, if you could recall one of your such cases which were most challenging, and how did you tackle the patient?
Not one.
Actually.
I think I've been practicing now 35 years, and I think endless number of stone disease, and there are so many ways of treating.
Yes.
Each treatment has its problem. Treating them is a problem, not treating them is a problem. So for example, if I would have had a large tag-on stone in a kidney, there are various ways to treat it. Suppose there are multiple stones, there are various ways to treat it. You can do an open surgery, which is an obsolete thing of course now. You can do a percutaneous nephrolithotripsy, make a small 1 centimeter hole at the back, put in a scope in various pockets of the kidney, what we call calyces, pick up them and come out. You can, if it is stuck in the ureter, you can do a ureteroscopy and take it out. You can do RIRS, you can go into every pocket and take them out. Localize them, blast it with laser, make them fine powder. So, I mean, I don't know how many cases, each case is a unique on its own.
Yes.
And each case is you take it as a simple, but I've seen simple stones can get complicated, and complicated stones can be removed simply.
Well, what do you think is going to be the next breakthrough when it comes to kidney stone domain?
I beg your pardon?
Well, what you think that it is going to be the next breakthrough when it comes to kidney stone domain?
Probably a gun will be available in the supermarket where you will put it on your back and blast your stone. No, I mean, innovations are a part of life.
Yes,
See,
actually.
When we introduced, I was one of the first person to introduce lithotripsy. That was in the 6th of August 1987. You must have heard of something called an ESWL or extracorporeal shock wave lithotripsy.
Yes.
That was first came in Germany in 1984. We got it in India in 1987. What was it? It was a total revolution.
Right.
We used to make big cuts. From there, it came to non-invasive, providing shock waves from outside, focusing the stone and blasting those shock waves, making them into fine fragments.
Right.
Slowly. What happened? That also, at that time, it was like a boom. It changed the total stone management. But then other modalities started coming up and giving better results than the previous one.
Right.
So innovations is a continuous ongoing thing. Anything can happen tomorrow.
Right. Any take-home message for our viewers?
Take care of your kidney stones if you get it. I won't say that there is something like that you keep on doing your x-rays and sonography every yearly or something like that. But be aware.
Yeah.
Drink more liquids. Avoid junk food. Live a healthy lifestyle. And by and large, if you have already a stone formed and removed and treated, then the take-home message is once a stone former, always a stone former.
Oh.
So don't think that you have removed your stone, you have treated your stone, so you are a free bird. So you need to take care of that and see what happens. And by saying that, drink more liquids.
Yes.
Pass at least 2.5 liters of urine in 24 hours.
Yes, sir.
Eat less of junk food. Avoid, don't say give up. I said avoid excessive milk and milk products and some of those, like dry fruits and kaju, badam, pista, those things which are rich in oxalate, fish which is rich in uric acid. You need to give up or go reduce on these substances to prevent the recurrence of stone formation.
Well, that was amazing having a word with you. Thank you so much for being here, sir.
Thank you so much.
Thank you, sir.